morning, viewer. Welcome to our Glory Globe TV. Here's the breaking news. Yes, one study shows patients hospitalized for flu or COVID-19 face increased risks of long-term health problems and death. Since the COVID-19 pandemic began, extensive research has emerged detailing the virus's ability to attack multiple organ systems, potentially resulting in a set of enduring and often disabling health problems known as long COVID. Now, new research from Washington University School of Medicine in St. Louis and the Veterans Affairs St. Louis Health Care Systems indicates that people hospitalized with seasonal influenza also can suffer long-term negative health effects, especially involving their lungs and airways. Comparative study of COVID-19 and seasonal influenza. The new study comparing the viruses that cause COVID-19 and the flu also revealed that in the 18 months after infection, patients hospitalized for either COVID-19 or seasonal influenza faced an increased risk of death, hospital readmission, and health problems in many organ systems. Further, the time of highest risk was 30 days or later after initial infection. Key findings and implications. The study illustrates the high toll of death and loss of health following hospitalization with either COVID-19 or seasonal influenza, said senior author Ziad Al-Alai, MD in clinical epidemiologist at Washington University. It is crucial to note that the health risks were higher after the first 30 days of infection. Many people think they are over COVID-19 or the flu after being discharged from the hospital. That may be true for some people, but our research shows that both viruses can cause long-haul illness. The statistical analysis spanned up to 18 months post-infection and included a comparative evaluation of risks of death, hospital admissions, and 94 adverse health outcomes involving the body's major organ systems. A review of past studies on COVID-19 viruses, the flu focused on a short-term and narrow set of health outcomes, said Al-Alai, who treats patients within the VA St. Louis Healthcare Systems and is an assistant professor of medicine at Washington University. Our novel approach configured the long-term health effects of a vast array of conditions. 5 years ago, it would not have occurred to me to examine the possibility of a long flu. A major lesson we learned from SARS-CoV-2 is that an infection that initially was thought to only cause brief illness also can lead to chronic disease. This revelation motivated us to look at long-term outcomes of COVID-19 virus flu. Glory Globe TV, Delhi, Bharat.